Dear friends of global health, dear ladies and gentlemen, dear young people who are active in global health, dear regional directors who are here with us, and any officials also from various governments. We have parliamentarians here, we have people from health ministries, and of course we have the members of the M8 Alliance, which are the core backbone of the World Health Summit, a group of academic institutions that has taken it upon themselves to every year host a regional World Health Summit. And this is why we're here. We've been in nearly all continents, and this year we are here in Washington, D.C. I might add already next year we will be on our, in quotes, last continent in Australia, working together also with the Pacific, really always also at each regional World Health Summit, giving that global spirit, but with a focus on the challenges the region has and what we can learn from the regions and take back to our main summit in Berlin, which is always in October. And we hope, of course, that we will also see many of you in Berlin. And that is why, as we have these various greeting messages, it is my great pleasure to first ask Dr. Axel Pries, who is the president of the World Health Summit and former dean of the Charité in Berlin, to come to the rostrum and to please welcome you. Please, Axel.
Yeah, dear Ilona, thank you very much. And I'm really overwhelmed by all the people here. I have to thank Adnan for being our partner, and as everyone knows, at very short notice to set up this beautiful meeting together with Steve and Keith, obviously, and the groups. And I think it's already, I had a small chat, it's already showing that bringing together these groups is very good for the discussion, because we are all used to be very happy in our silos one way or the other, and going out of the silos is very relevant. And I think it's called a regional meeting. As Ilona said, it should focus a little bit on also the regional requirements and viewpoints. But it's also clear that we cannot meet without seeing the global perspective, because these are so much interlinked and the dependencies are so much increasing that it is more or less impossible, or increasingly impossible, to find local solutions in a situation where global threats are coming in. And the pandemic has shown that. Has also shown how ill-equipped we are mentally dealing with these issues, because a global threat is immediately responded to by very local and at times national, at times even nationalistic responses, and we have to overcome that. And that was also for us the reason to go here to Washington, to strengthen this kind of interaction. We had the meeting on transatlantic partnership, but it's also a global partnership which we need. And in the meeting on transatlantic interaction, the statement that in a global context, no one is safe until everyone is safe, was repeated very many times. But that's a little bit passive. I mean, it just describes a status. It doesn't describe what we have to do. And I think we could also put it the other way around and say we won't be safe until everyone contributes. We will not be able to create a world where there's more safety if we can't get the people to contribute. And when I say people, it's individuals, it's organizations, but very relevant also states. It's also the stakeholders, the different parts of the society. And in order to do that, we need more international or social cohesion in the world. And that was addressed very well in the meeting, which I just had the pleasure to attend. And in a way, I think we also have to look back to the last 4 or 5 decades of what they call globalization. It sounds good because it says, okay, everything has to be viewed on the global perspective. But if you look at it, how it was handled, there is a certain component there that the rich were dominating the poor in the globalization. The very well developed and very well equipped were dominating the less well developed and less well equipped. And also centralized approaches were dominating local requirements and local characteristics and local viewpoints. And if you do it like that, then obviously you destroy trust. And that was also a key element in the meeting right now. Without trust, without cohesion, there will be no success. And we will, in 10 years, have the same problems right now. And the trust has unfortunately not increased during COVID times. There were many issues which eroded trust by one way or the other. And I think without increasing trust, mutual trust on all these different levels, individual, but also governments have to start trusting each other again. And I know that this is really a very difficult way to go, but it's necessary. And I think we need a something like globalization 2.0, because we cannot do it not globally, but this globalization 2.0 should be based on a vision which is really shared by everyone, like the SDGs, something like healthy life on a healthy planet, which is not dominating anyone with ideas they cannot easily follow. And then we need inclusive approaches to work towards that, which are based on mutual respect for the individual approaches, following these overall guidelines, and create a justified trust. And I hope that this meeting will contribute to that. And I wish you a very, very pleasant time here. The weather is just perfect. We didn't even expect that. And so it can only be a big success. Thank you very much.
Thank you very much, Axel. And that might be the positive aspect of this room. It doesn't have any windows and we can't see how beautiful it is outside. So it will keep us here also, of course, because the program is so fantastic. So thank you, Axel. And you alluded to it. It needs a local base for what we do globally. And we are so proud at the World Health Summit that we have the M8, the most prestigious universities of the world have come together as a group to support this enterprise. And therefore, it's my great pleasure to invite Dr. Mark Wrighton, who is the president of George Washington University, our local host here, to come and speak to you. Please, sir.
Thank you very much, Dr. Kickbush. It's really an honor to be here. If you know my background, which many of you would not, I'm not a healthcare expert. I'm not a public health expert, but like many people, I spent a lot of time in front of a television during COVID-19. During the lockdown, I learned so much, and the work that many of you are doing is so important to people like me and hundreds of millions of people all around the world. Participating in this World Health Summit as a local host is a real privilege. I'm proud to be listed alongside these important organizations and partners, and I'm really proud of my colleagues in the Milken Institute School of Public Health. I want to thank those who have organized this regional meeting for turning to the George Washington University as a local host. We're very proud of being the #1 school of public health in the District of Columbia. However, there are only one institution of this kind. But in absolute terms, I've learned that under the leadership of Dean Lynn Goldman, we're making a difference nationally as well as locally and even internationally. We have many people at our university from other countries. Alumni of the university are living in approximately 150 countries, and they're making important contributions based on the educational experiences that they've had at George Washington University. We have many distinguished faculty members with us at George Washington University. They're providing, of course, the educational leadership, and they're providing the research leadership. And Dr. Adnan Haider is the international president of the World Health Summit, and I would like to thank him especially for his leadership. Please join me in giving him a round of applause. I've been associated with organizing large conferences that include international conferences. I know that a lot of work is behind the scenes, as they say, but critical to a successful conference. And I appreciate all those who have been working to make this regional meeting so successful. I had the opportunity to listen in at a meeting that was occurring in this very room, and I heard a question about gun violence. This is a challenge, certainly, for this region and nationally, and I believe it is one of the great public health challenges, at least of the United States, and I'm appreciative of Dr. Haider's becoming involved with the consortium of universities in this region to work to overtake this challenge and to make progress. It's a real privilege to be here, as I've said, and I'm looking forward to the remainder of this introductory session. Thank you very much.
Thank you very much, President Wrighton. We are indeed very honored that you made the time to come and speak to us, and even made the time to listen in to some of the discussions. And you have, of course, highlighted the very important role that universities, and in particular schools of public health and schools of medicine, play in taking social agendas forward by also showing their health impact and making clear that maybe also we achieve progress if we start to see some issues through the lens of health to take it forward. So you already mentioned the issue of consortia. This is something that is, of course, developing in the world of science, in the world of global health. We can only move forward if we cooperate. And it's my great pleasure to invite now one after the other two of the important networks, consortia, associations that are also linked to the M8, and of course also linked to this regional summit. And so first I'd like to call on Dr. Keith Martin from the Consortium of Universities of Global Health, which are meeting in parallel, of course, and integrated. Please, Keith, the word is yours.
Thank you very much, Dr. Kickbush. And from all of us at the Consortium of Universities for Global Health, a very, very warm welcome to all of you, literally and figuratively. And I think we've all established today that we are not just Zoom creatures. I'd like to thank, of course, all of you, our esteemed guests, all protocols observed, if we can say that. And again, I want to echo Dr. Kickbush's comments and the President's comments. Thank Dr. Haider and his entire team. Aisha is here too, for all of your hard work. We're like ducks, right? It moves along, but what goes underneath is an entirely different situation. If I may get a little bit of history here for a second, you are all part of history. What is happening now and in the next 48 hours has never happened before in history. Some years ago, our former president, Dr. Pierre Buchans from Tulane University, the former dean, integrated us, went to the World Health Summit meetings, and brought us into the fold of the World Health Summit. This was outstanding, because that what enabled us to do is to build these partnerships that we're talking about today. Fast track forward, what we have today, as Dr. Kickbush mentioned, is for the first time in history, the World Health Summit regional meeting is taking place here, right next to the Consortium of Universities for Global, our meeting, and also Dr. Cantor's team, and Dr. Cantor, who leads the Association of Academic Health Centers International. So that has never happened before. But why did we do this? We recognize, as you've heard before, is that the only way we're going to address the compelling challenges before us is through partnerships. I think all of us have seen across both sides of the Atlantic that the challenges that the countries of the world face are not purely scientific. In fact, there's a deep undermining of the post-World War II system that's a deep existential threat to every person in every country on the planet. And what do we need to do about it? What you're doing is to be able to do that, coming together, bridging academia, not only together as different academic institutions, as you all represent, but importantly, bringing in other sectors. We had at our meeting, actually just before this, we had the opening of the global surgery meeting, our 5th global surgery meeting, strengthening the ecosystem for global surgery to deal with not only gun violence, as the president mentioned, but so many other challenges. Who opened that up? But the vice president of Ecuador, as Dr. Magana, the head of ASPPH, is here, who knows very, very well. So we're not only engaging us together as academic institutions, but we're bringing in together, importantly, the political structures, bringing in NGOs and other sectors, because unless we do that, friends, we're not going to be able to be the bulwark and the engine that's going to drive the evidence-based solutions, the capacity building and the structure that's going to be able to improve the health of people and the planet, which is what we do. And our former chair, Dr. Ann Kurt, the head of the National Academy of Medicine, is here representing associations and groups. So I just want to close and say that this is not the end. It's not the beginning of the end. It is the end of the beginning. So just please see at us at CUGH that we are a strong partner of yours. We want to work together, and together with the World Health Summit, with the WHCI, with CUGH and others and all of our partners, we will work together to build those bridges across the Atlantic and build a safer, secure world for all. Thanks so much.
Thank you, Keith, and thank you for that strong message on partnership, on intersectorality, and on working together in a world that sometimes seems very divided, getting even more divided, and how much perhaps health can be an issue that still allows us to speak together, to work together. And I think having the honor of 2 regional directors from WHO here, where countries come together to do exactly that, is, I believe, also a very, very critical message. You've already heard Dr. Stephen Cantor is also here with us. He's the Executive Director of the Association of Academic Health Institutes, health centers from around the world. So please, Dr. Cantor, the word is yours.
Well, thank you, Dr. Kickbush, and warm greetings to everyone from the Alliance of Academic Health Centers International. It's really exciting to be here with all of you. WHCI, the Alliance of Academic Health Centers International, is an association that brings together the top leaders of academic health centers from around the world. We bring our members together to explore critical and timely issues for academic health centers, such as strengthening the global health architecture and how that requires every voice to be at the table. Issues such as examining how health security and the climate crisis are intensifying the need for collaborative action, and how partnering with communities can improve the health of all. WHCI is proud to have been a founding member of the M8 Alliance, and we are truly delighted to have the opportunity to be here and to be part of this World Health Summit regional meeting. When associations come together, as we are doing here today, to work and act collectively, there is an exponential increase in our power to improve the human condition. And we are investing in the future. All things I don't have to say to this group, but maintaining strong connections across borders and boundaries, as we are doing here today, is investing in the future. And cultivating a steady stream of highly competent health professionals and scientists who improve the world and give back to their country and region, as we are doing here today, is investing in the future. And so on behalf of WHCI, I welcome each of you. We look forward to the upcoming sessions today and over the next few days. And we're very proud to join the World Health Summit and the Consortium of Universities for Global Health in this really exciting meeting. Thank you.
Thank you very much, Dr. Cantor. Now, we've heard a lot about prestigious institutions, universities, centers, collaborations, but what would all of those be without their students? And we from the World Health Summit have, from the very start of the summit, made it a key component of the summit to have young voices. That discuss in all the meetings we have, that have a voice in the panels that we organize, and that can bring their ideas, their innovation to the summit. And I think particularly last year, the visibility and the energy of students at our Berlin summit was just extraordinary. And therefore, I think for us, it is very important that now you will have a welcome from the students. And so I say it correctly, Ms. Prabha Raghavan, who is the president of the university's Public Health Students Association, welcome, will speak to you.
Thank you so much, Dr. Kickbush. And also, once again, repeating what everyone else said, thank you so much, Dr. Haider and his team, Aisha, for putting all of this together. I don't know how you did it in such a short turnaround. It's insane, but really, really excited to be here. I want to go back to something that Dr. Keith Martin talked about, which was the emphasis on partnerships. And I feel like my role over here on this podium for now is to highlight an important stakeholder, which is the students. So it is truly an honor to represent my fellow public health students on a platform with such eminent speakers and to amplify our voices in this critical discussion. Over the past 2 years, I have been privileged to meet and work with brilliant and highly motivated peers who share my passion for tackling the profound global health emergencies that we face today. And because I am a former journalist with a penchant for lame jokes, please excuse me, I am proud to report that we as public health students and the future of public health are a force to be reckoned with. Our diverse backgrounds and interests allow us to approach public health challenges from different angles, and we are excited to bring our ideas and perspectives to the critical discourse of bridging the science to policy gap for global health. As the future of the global health workforce, we recognize the importance of sustained leadership, intentionality, and strategic engagement in translating scientific evidence into practical policies. We are gearing up to bolster the impact that you, our distinguished guests, have had on the unprecedented challenges that we face today. Some of us are in this room. I don't know where you are, but if you're a student here, please raise your hand at least so I can, oh, hi. It's great to see all of you here. So yeah, some of us are here in this room. We're eager to soak up the expertise that you have so painstakingly cultivated in your careers. And in closing, I want to thank you all for your leadership and the work that you do every day to improve global health. We are thrilled to be here today, and we look forward to engaging with you in a spirit of collaboration, openness, and dedication to making a meaningful impact on global health. Thank you. Thank you.
Thank you very much, Prabha. And you see, we are sort of moving to balance a rather male welcome with some very strong female voices. Thank you very much. And we'll continue along those lines. And you, Prabha, ask a question, how did you do this? If there is one person that can probably answer this question, it's our next speaker, Dr. Asha Jaffrey, who's been the program manager of the World Health Summit regional meeting here. And she's, I'm trying to imagine her as a duck, sort of, I'll give you a gift of a duck, I guess. So please do come up and give your short welcome to everyone. And I think you're going to announce something as well.
Good morning. Through music, we wish to set the tone of the World Health Summit Regional Meeting 2023 and invite you to enjoy the culture of the country in which this meeting is taking place. In the 1970s in New York City, elements of hip hop emerged, and today it is arguably the most consumed musical genre of this country. Today's opening ceremony will be provided by musical artist and George Washington University instructor, Dumi Wright, GW teaching assistant, DJ RBI, and GW student, Tyler Lackey. You can dance.
1, 2. Good morning. How's everybody feeling? So I realize this is somewhat unorthodox, but I'm glad we're doing it to celebrate culture. And we're going to talk about themes through the music, because after all, music is the language which we use to communicate from historical days until now. And so we'll continue this tradition with hip hop. I am Dumi Wright, the first African hip hop artist to record a record in America back in '92. You can look that up, but that's all aside. I'm here with folks and honored to be at the World Health Summit and share some things with you. One of the most, I guess, basic instincts of the human condition is freedom, right? We all want to be free, liberation. So I think it's appropriate in the tradition of the great poets and singers like Bob Marley that we talk about liberation and freedom. So are y'all with that? So when I say people want liberation music, say yeah. And I say got a platform, you got to use it, say oh yeah. And if you're not sure how that goes, look at the person next to you so they can keep you up to speed. So DJ RBI, without further ado, let's talk about people want that liberation music. Got a platform, we got to use it. If it ain't right, we must refuse it. Exercise your rights before you lose it. People want that liberation music. Got a platform, we gotta use it. If it ain't right, we must refuse it. Exercise your rights before we lose it. People want the music of the liberation. Seems that all we're getting is a whole lot of misinformation. Even though it's in the air, it's not always apparent. The level of success is not proportional to talent. The level of perception is not proportional to truth. The rate of our conviction is not proportional to proof. Make the most of what you got. Hope that you don't bury it. Regret can be a heavy burden. Hope that you don't carry it. Ignore the writing on the wall at your own peril. Sometimes the path that we should go is not always apparent. Sometimes the right way is not always unanimous. Sometimes the path you go It's not unanimous. I'm not surprised by all the lies. It's getting really crazy. Yo, need more than what you get from the TV and the radio. They say if I don't like it, I can just change the station. It's way bigger than that. I'm trying to change the situation. People want that liberation music. Got a platform, we gotta use it. If it ain't right, we must refuse it. Exercise your rights before we lose it. People want that liberation music. Got a platform, we gotta use it. If it ain't right, we must refuse it. Exercise your rights before, yo. Why try to conform when you were one out of a million? We laid the foundation so you know we're out here building, trying to make it better. See, can't just sit and let it be. More than entertaining, it's pertaining to a legacy. Speaking truth to power, even questioning authority. If children are the future, shouldn't they be the priority? And action when it happens doesn't seem to be the focus. Sound good when they say it, but in reality, it's bogus. Can't get peace and unity with coonery, buffoonery. Think they're out here fooling me, but enough with the tomfoolery. Cleverly disguised, just a bunch of lies with monopolies, no competition, innovation dies. Flashback to reality, view the picture in totality. It's just getting worse. It went from crisis to calamity. Hints of the apocalypse, surely it's a sign. Everything around you burning and still saying, this is fine. People want that liberation music. Got a platform, we gotta use it. If it ain't right, we must refuse it. Exercise your rights before you lose it. One more time, people want that liberation music. Got a platform, we gotta use it. If it ain't right, we must refuse it. Exercise your rights before you lose it. So I wanted to share with y'all, and I think the music, we gotta figure out how to get some of the distortion out and get it turned up, but not, so it's not breaking up. But I was asked to reflect on how the pandemic affected me as a person, as a parent, as a musician, as an artist, and just kind of as a citizen of the world. And so I wrote a song about it. You want to hear it? Here we go. People thought it only affected a small percentage. It wasn't authentic, upside down, all around, tangled up in this pandemic. Need to harness energy, make a movement that's kinetic. If we fail to act like with the Spanish flu, we will regret it. Some say it's a reset, others think that it's a warning. Global warming, climate change, all these problems swarming. People in power can't ignore it. Information, gotta record it. Now the stakes are so high, most of us cannot afford it. Healthcare. We could really use some help here, especially deadly for lower income. COVID-19 doesn't care. Time to make a shift. Focus on the simple things. You and I don't know when we will die or what the future brings. Doesn't matter where you reside, can be dangerous going outside. Social distance, slow the tide. Gotta survive, so many have died. Cut through all the debates, cannot make the same mistakes. All the actions that we take determine the future we create, because unity, it can't happen without you and I. Want to change the world? They ask, who am I? And how do I have the audacity? I can't do it alone, I don't have the capacity. They say many hands make light work. If everybody plays a part, then it might work. It's progress. Try to come together, and if we come together, we can make it through the struggle. So if y'all are with me, we can go forward and move to the top. Does everybody want to go to the top and move forward? All right, with one voice. So we can meet at the top. This is the hip hop introduction to the conference. Read the agenda, you'll see no nonsense. Nothing's gonna stand in my way, I won't let it. Can't stop me now, you can forget it. I'm ready to ride, let's get it. Meet me at the top, cause that's where I'm headed. Getting so close, you all can taste it. Learn from everything that I lived, none wasted. Instead of running from fear, keep holding on, cause I know I'm gonna make it. Got the mission planned out. Start small, expand out. Not something you necessarily learn at academy, had to go through it to find the right strategy. Now I feel I got it down pat. Dedication, inspiration, found that. Even though at first it might be a little slow, when you're at the bottom, up is the only way to go. Making progress, we're right there. I can see the destination and it's getting quite clear. No matter what, I'ma keep striving. Everything I'm looking for is right on the horizon. Nothing's gonna stand in my way, I won't let it. Can't stop me now, you can forget it. I'm ready to ride, let's get it. Meet me at the top, cause that's where I'm headed. Nothing's gonna stand in my way, I won't let it. Can't stop me now, you can forget it. I'm ready to ride, let's get it. Meet me at the top, cause that's where I'm headed. Any situation, you gotta stay focused. Tunnel vision on a mission if you didn't notice. Get the job done, hopping over obstacles. I don't know everything, but I know anything is possible. Making moves while they're debating who the best is. I'm redefining what the meaning of success is. If you have a setback, overcome it. Even though I'm leading in the race, I haven't won it yet. Still got a way to go. Got no time for small talk. Call me back later, bro. Pedal to the metal till I hit the finish line. Not if, but when. It's just a matter of time. Till we get there, won't stop running. If you see the former champ, tell him that I'm coming. We're on the rise and everyone can see that. Meet us at the top, because you know where we'll be at. Nothing's gonna stand in my way. I won't let it. Can't stop me now, you can forget it. I'm ready to ride, let's get it. Meet me at the top, because that's where I'm headed. Nothing's gonna stand in my way, I won't let it. Can't stop me now, you can forget it. I'm ready to ride, let's get it. Meet me at the top, because that's where I'm headed. So throw your hands in the air and wave them, because you really, really care. And if you're ready for the World Health Summit to start, somebody say, oh yeah. Oh yeah. Thank you. Meet me at the top, because that's where we're headed.
Now that's a message for public health. Meet me at the top. And if we're talking about history, I think probably this was the very first global health meeting opened with hip hop music. So thank you. And I hope we can share with everyone, first of all, this wonderful music, the dancing, but particularly the COVID text. I think that expressed so much of what was our public health concern in that period. So we've all had a very special experience, and I think it's also put us in the mood for a conference. And who better to pick that up than Dr. Adnan Haider, who is now the international president of the World Health Summit for the regional meeting 2023. He, of course, also has a day job, even though he probably didn't notice it in the last couple of months. He's Senior Associate Dean for Research and Professor for Global Health, Milken Institute School of Public Health, of course, at the George Washington University. So, Adnan, I'm delighted to be able to hand over to you for the next session. Thank you.
Thank you very much, Dr. Kickbush. By the way, that's how we do it at GW. That's how we do it at GW. Yeah. When I told Aisha, I said, I want a musical performance to start this conference. That's the power when you work with bright and intelligent people. They take your idea and implement it in a way that is just incredible and amazing and wonderful. So thank you, Aisha, for making this happen. And to my colleagues who are affiliated with GW, thank you. Peace be with you. Ladies and gentlemen, it is my incredible honor to welcome you all as the international president of this summit. We have tremendous dignitaries, many of whom are out here in the first row. I want to especially thank Dr. Axel Priest, the president of the World Health Summit, Dr. Ilona Kickbush, the M8 Alliance members, and the executive committee for allowing us to have this summit here. And thanks to all of you, not only here in the room, but we have nearly 1,000 people online right now watching this meeting. And so welcome to all of you who are online in the Zoom webinar. President Wrighton and Dean Goldman have been tremendously supportive of George Washington University's input here. Thank you very much for your support. Keith Martin and CUGH and Steve Cantor with WHCI, thank you for your partnership in organizing this. But I really want to thank all our staff here in Washington, D.C. and in Berlin. I can't name everybody in addition to Aisha, but Jörg Heldmann and Julian Kickbush and all the team in Berlin has been absolutely fantastic. And I want to thank those who are supporting this in different ways. the World Health Organization, EU office, the European Regional Office, the Pan American Health Organization offices, the YouTube Health, the Junaid Family Foundation, for whom this was one of their first ventures, foreign policy, economist impact, embassies around the city, and many, many more who've served and to step up to really support this regional meeting. Thank you very much. Ladies and gentlemen, I'm really honored to chair this plenary session. I have been known to say that global health is inherently political. And when I've said that historically, I've been challenged. But no, if you are a global health expert, you shouldn't be political. I think there's a misunderstanding of politics, politicization of health, and the streams of politics and global health meeting together. But in the past 3 to 4 years, there has been this incredible realization that actually those two streams overflow. They mix together. It is incredibly important that we become better at playing this game. Because if we don't, evidence sometimes loses. Science does not dominate. Decisions are made that are not based on evidence, but rather on other ideologies, no matter how important or valuable those ideologies are. And so I'm so honored and delighted that today we will have 4 eminent speakers who will discuss this issue, who will talk to us about their perspectives, their experiences. It's an amazing and diverse panel, and I'm going to introduce each one of them. But first, an apology. Each one of you has a bio that is 50 or 100 pages, and I don't have the time to go through that entire bio sketch. So I will pick and choose with your permission and with your grace. As I welcome you, I invite you to join me on the stage. Dr. Jarbas Barbosa is the Regional Director of the Pan American Health Organization as of this February. Dr. Barbosa, first, as a neighbor of George Washington University, we welcome you to this meeting. Dr. Barbosa has served as the Assistant Director before being the Regional Director. He has led in this region the response to the COVID-19 pandemic. He has a medical degree, a master's degree, a PhD in medicine and public health from Brazil, served in the Ministry of Health. What an incredible honor, sir, to have you today. We are representing the United States, and I'm so delighted that the Department of Health and Human Services and our Assistant Secretary for Global Health, Ms. Lois Pace, is with us. Ms. Pace is no stranger to global health, has worked incredibly hard at the United Nations, at the World Health Assembly, has worked all over Africa and Asia. Most importantly, like myself, is an alumnus of Johns Hopkins University. And I'd like to welcome you on behalf of the World Health Summit to join us today. With qualifications in medicine, surgery, OBGYN, having worked in Médecins Sans Frontières, having led numerous offices of the World Health Organization, and then finally, 3 years ago, becoming Regional Director of the European region, Dr. Hans Klug is with us today. Dr. Klug has worked incredibly hard across communicable and non-communicable diseases and in intersectoral health. Dr. Klug, a real pleasure to welcome you today. And while my 3 eminent colleagues on the stage are truly experienced, in fact, they represent the health and medical sector, which meant that we really needed somebody who's experienced on the political side of things. Being the ambassador to the country of Korea for the government of Pakistan, prior to that, being a political counselor right here in Washington, D.C., having served as the Director General of the Foreign Service Academy, having degrees in physics, international relations, European studies, and public administration, it's my great privilege and honor to welcome Ambassador Mumtaz Baloch, the spokesperson and additional secretary, Ministry of Foreign Affairs, Government of Pakistan. I'm now going to request each one of you to spend 5, 6, maybe 7 minutes and reflect on this theme of global health in a political world. And I'll go from this end to that end. Dr. Jarbas, from your tremendous experience, particularly from this region where we are meeting today, we'd love to hear your perspectives on this topic. Over to you, sir.
Thank you. Good morning. To my distinguished colleagues here at this panel, I also want to thank the M8 Alliance and Dr. Adam Haider and the George Washington University Milken Institute School of Public Health for their kind invitation to participate in this opening plenary. I'm here on behalf of the Pan American Health Organization, that is a double organization. We serve as WHO regional office for the Americas, but we are at the same time as an independent organization that belongs to the Organization of American States system. WHO was formed 120 years ago when President Theodore Roosevelt and delegates from across another 11 countries across the Americas gathered here in DC to develop a response to yellow fever, which was delaying the construction of the Panama Canal at the time. The solution, as they saw it, was to work together to protect the health of our region. And together, over the course of 120 years, PAHO and its member states have been working to bring this vision to life. Together, we have eradicated diseases, built health systems, and enabled more people in the Americas to live healthy, productive lives. This shared legacy is why I am optimistic about the subject of today's panel, Global Health in a Political World. PAHO's history is proof that we can overcome political divisions and work together to keep health as a priority, even amid global and national conflicts. Still, despite remarkable progress over the past decades, health remains a promise unfulfilled for so many people in the Americas. You see, we are a region facing persistent inequality. More than 80% of our population lives in urban areas, including urban slums, with poor access to water, sanitation, and other essential services. Nearly half of our people participate in the informal economy, and nearly 1/3 live below the poverty line. And yet, families are still asked to cover more than 1/3 of their health care costs from their own pocket, forcing them to choose between their health and their livelihoods. This is unacceptable for all of us. And it is why expanding and ensuring equitable access to health is one of the core pillars that I will work hard to achieve during my tenure as PAHO director. Getting there will require both large-scale changes and making use of solutions that are already within reach. But it all must start with strengthening and renewing primary healthcare, the bedrock of resilient health systems. Our community health centers, local clinics, and other health outposts must be trusted places where families can turn for prevention, diagnosis, and treatment. Just as important is strengthening those primary healthcare systems to conduct the invaluable work of surveillance and prevention. Primary healthcare must be our first line of defense against the spread of disease and enable us to identify new health threats as they happen. I also hope to see our region take better advantage of new health technologies and innovative approaches and challenge countries to become drivers, not just beneficiaries of health innovation. Because as we saw during the COVID-19 pandemic, our region too often struggled to access life-saving tools like diagnosis, drugs, and vaccines. In fact, Latin America and the Caribbean depend almost entirely on other regions to produce the tools that population need to stay healthy. This too is unsustainable. Expand our region's capacity to manufacture medicines and vaccines will be essential to protecting us against health threats now and into the future. Our region has not only the manufacturing expertise, but also the market to leverage new products. And through PAHO's own regional procurement mechanism, the revolving fund for vaccines and the strategic supply fund, we can pool needs and funding to purchase healthy tools at affordable prices, helping our member states make the most of their limited resources. At PAHO, we have a long-standing commitment to expand the access to health in all corners of the Americas. But of course, we cannot achieve this alone, which is why meetings like this one are so important. We must work together as collaborators, partners, and public health champions to expand the access to health. I hope that PAHO will continue to be your trusted partner in supporting the countries of the Americas to improve the health and well-being of their populations, especially the most vulnerable. Improving global health in today's world requires that we continue to find common ground across sectors, disciplines, and political differences. Only then we will overcome persistent inequalities and build health systems that can respond to emerging threats and help us recover and rebuild from the pandemic stronger than before to achieve our goal to universal health. Our success rests on implementing the most critical lessons from the pandemic, that health enables all progress. We must keep health at the core of economic recovery, poverty alleviation, climate adaptation, and development efforts. This is a commitment that on behalf of PAHO, I want to stand in front of you. And I also look forward to working alongside you as we will fulfill the promise of health. Thank you.
Thank you very much, Dr. Barbosa. First, for reminding us that inequality, specifically health access, is an issue. To think about primary healthcare systems, you use the word resilient health systems. I'll come back to that later on in our discussion. But also to remind us about innovation and health technologies, that there are mechanisms by which that inequality and inaccess can be handled. Thank you for your welcoming hand of partnership to all of us present at the Regional Summit. Ms. Pace, how would you like to reflect on this topic, please?
Well, hi, everyone. It's really fun being back in this room. I don't think I've been back to the Washington Hilton since I've been in this role, and I'm having flashbacks to CUGH conferences of many years back. So hi, Keith, it's good to see you here, and it's great to see friends and others in the audience whom I know. Look, one of the pillars to our work in this space is equity. And I know that that's been a term a lot of us have been sort of pointing to and using over the past few years. And so I think, one, it's important for us to recognize as a US government how significant it is for us to actually say it out loud. And I know it's something that other people have been talking about for a long time and have been pursuing for even longer. But the reality is it's newer for leadership in the US administration to really lean into that as a principle. So I don't want to sort of overlook that. But that said, it needs to be more than about our ambition in the space. We need to define it very clearly for ourselves and for others what we mean by equity. And so there are a few ways we've tried to do that, which I think are important to share here. One is, well, first, sort of the community or communities to which we're referring. And so my boss, the Secretary of Health and Human Services, Secretary Becerra, really talks about the importance of ensuring that we are meeting people where they are and ensuring that people, no matter who they are, have access to and the benefit of health and well-being. So regardless of age, race, geography, ability, sexuality, and the like, really ensuring that we are clear about the disadvantages some of these individuals and communities have faced, but then more importantly, are focused on how we address or meet their needs overall. One of the ways that that we do hope to achieve that goal is by pursuing something else that the US government hasn't always leaned into, which is universal health coverage. And so again, it's a term that we have used in a goal that we have had in the global health community for years, but now this is something the president talks about, right? And that's not nothing. So I want to pause there and celebrate that. But then again, we need to define what we mean. Luckily, the SDGs have done that for us, and this community have helped articulate that so that we know what success looks like. And I think we, as an administration, have tried to pursue those various metrics, whether we're talking about workforce or, other parts of the health system, whether we're talking about affordability or financial protections. But regardless, that is something that you should know we care about, and a mechanism that we are using to pursue this idea, dream, hope of equity. Because if we learn nothing else, is that we're not there yet, and we need to be. Now, how do we then continue to operationalize this goal? I talked about this a little bit this week already, but not quite in detail. There are a couple of ways that we in the US government are thinking of the work moving forward, especially given so much time has been spent on global health emergencies and the important work of pandemic preparedness and response. Now, that work continues. It has to. Global health security is not going away as a political priority, and I think that's something we have to acknowledge. And I think that that's a good thing, because we still need to sustain some momentum in this space and ensure that we are continuing to meet the moment. And if we think about global health security and what remains as work to do, that's on the one hand improving existing mechanisms like the international health regulations or perhaps the global health security agenda. But it's also pursuing newer platforms, like whatever will come of this pandemic accord and the various negotiations happening in Geneva, or what many people are talking about this week around a new pandemic fund. And I know people are nervous about sort of now this ballooning global health security ecosystem. And I think that anxiety is appropriate because we can get this wrong, right? But I think by really understanding what all is on the board and ways that those existing and new mechanisms or platforms or institutions come together, even with other parts of the global health architecture, right? Whether we're talking about Global Fund and Gavi or Africa CDC or the Caribbean Public Health Agency, there's an opportunity for us to connect all those dots and really ensure that however we reemerge from COVID or these other crises we faced the past few years will make sense, right? And will truly be elevated so that we can be responsive, but also resilient to crises. But global health security aside, we also need to pay a lot of attention to global health broadly. And what you will hear more and more, I think, leaders from the US government talking about is how we reclaim the gains, right? And how we reinvest, revitalize, or otherwise restore the attention and focus on other critically important global health priorities, because we all know that has largely fallen by the wayside. So it's great that we're going to have a high-level meeting on tuberculosis this year to remind us of that important priority. It's equally important that we have a high-level meeting on UHC. It's also critical that we continue to focus on issues like sexual reproductive health and rights, because clearly that deserves our attention and action. And even for the many issues I haven't named, right? NCDs, in which I used to work, or antimicrobial resistance, we know that the list is long in terms of what's been left off the table. And now is the time to step back and, as Director Barbosa was saying, think about the system that will support not only health emergencies, but health access. I think the last thing I will say is also drawing from remarks that Director Barbosa made about the importance of partners and partnership. And I'm glad that I'm joined by our two friends, both from PAHO and Euro, because we'll be together again tomorrow to sign our first ever, I think we're calling it a collaborative arrangement. Some lawyer came up with that, surely. but it's, just a way to formalize how we work together, particularly in the wake of COVID, but also really looking at how we better prepare for the future, drawing from innovations and other opportunities, but again, ensuring that that's done in an equitable way, looking at the communities that are often left behind and ensuring that we can close gaps in this space that will service working into the future. That's not just about PAHO and Euro and HHS, but it's also about each of you, because as part of that arrangement, we also are calling out communities, civil society, industry, and important partners in this space with whom we'll need to work to make this happen, because we know that collective action is really our only option. So those are my thoughts on this topic, and I'm looking forward to more discussion. But again, thanks for having me here.
Thank you so much. Thank you, Ms. Pace, particularly for digging a little bit deeper into the principle of equity and how do you operationalize that, whether through security mechanisms. And I'm really glowing when you say reclaim the space, which is really important for US government and for US citizens to do. And thank you for a reassurance on partnership, which is incredibly important. Dr. Klug, you've already been given a segue with this transatlantic celebration. Tell us a little bit about your perspectives on this topic.
Thank you very much, Professor, and everyone, and Dr. Jarbas, Ms. Pace, Madam Ambassador. First and foremost, I would like to thank you, Aisha, for a wonderful opening. I'm very proud. I brought my eldest daughter to DC, Anastasia, and now she sees that her dad is not part of a boring group of people, but really part of a hip-hop generation. Actually, I did play for 12 years the baraban. So I must say that thank you again for your seriously hospitality. We had a great session this morning. And I would say that the fact that we're sitting here with our close allies and friends on thinking through how to advance public health leadership at a global scale is testifying that the policy realities that we are facing, we couldn't think about it 10 years ago. Maybe just as a word of information, many of you may be aware, some not, that as a region director of the WHO European region, it's a region which is comprised of 53 member states. So it includes the 27 of the European Union, but 26 more, going from Greenland in the west up to the Pacific Ocean and the Russian Federation in the east, which is a very, very diverse region. Some number of things which came out of the last 3 years, because when 3 years ago I became the region director, there were 0 crises in my region of global impact. And at least there has been 4, if I look 3 years later. The first one, the COVID-19 pandemic. And we should always remember, as Ms. Pace and me and Mara are always discussing, that it was both our regions which were really the epicenter of the pandemic. Second was the Mpox. The third one is the re-emergence of vaccine-derived outbreaks of poliomyelitis, where the cases in New York were genetically linked to those in my region, like in Israel, linked then to Afghanistan and Pakistan. So I'm very humbled that Madam Ambassador is joining us as well. Looking forward to learn from your experience, Madam Ambassador. Then the fourth one, of course, is the unexpected and devastating war in Ukraine, which we do not see for the time being, at least any signs of de-escalation. And 2 points coming out of that one is, number one, that coming out of the acute phase of the pandemic, we really need to continue to mobilize the political forces that we mobilize together as a health community to health and well-being. While at the same time, number two, to depoliticize when it comes to issues of political pluralism, as Ms. Pace was telling, of sexual, reproductive health and human rights, rights of the LGBT community, very important. And also to make clear time and again that attacking health and healthcare during any war is really breaching a red line. So these are a number of important points. It means that we have to be politically very astute and listen to the people. What do they want? Because definitely in the European region, we have a huge deficit of trust by the people, which then is eroding social cohesion and the values that we are fighting so hard for, of universality and solidarity. So we have to be politically very astute, listen to the people, but at the same time, work based on evidence. Because if we leave the path of evidence, that's a very slippery road. And it's very worrying to see how our scientists, including many of you, are being threatened. One of them, my good friend, Dr. Anthony Fauci, who I'm going to see again tomorrow, we really should nurture and protect our scientists. That's very, very important. So looking then at the lessons learned, it was very clear for me from the very beginning that we have to tackle those huge crises transatlantic in a very close partnership. And I'm very, very grateful to you, Ms. Pace, to your colleagues, to Mara Burr, to the Elizabeth Cameron, who joined us in this morning, to the people of the State Department, USAID as well, for immediately welcoming us and being so keen to develop this transatlantic partnership, which will result tomorrow in the signing of the first ever tripartite agreement. But signing is one thing, already starting to implement. And that's, in fact, key around several topics, like, for example, what I call the preparedness 2.0. Key issue is still equitable access to medical countermeasures. Are we better prepared? I definitely would say yes, but of course we are not there yet, because we're sitting here in Washington about 2 regions, but of course there's 6 regions for WHO globally. So equity is very important, not only on the COVID-19, on the mpox, but also on HIV/TB, where we still don't have any vaccine. Number 1. Number 2, to work together on the biggest killer, which remains non-communicable diseases, chronic diseases, which has a lot to do with commercial and political terms of health. In our region, people are being pushed into poverty, including in the richest countries, because they can no longer afford to pay for medicines for the 2, 3, 4 chronic diseases they have at the same time. We call it comorbidities. And then the third one is on the digital revolution. I tell with healthy envy that this region is far ahead in artificial intelligence, personalized medicine, and we would like to learn from this. But in the European region, we have a very strong history of regulation. If you have only innovation without regulation, that's very tricky. And it was President Biden who called recently upon the developers of AI to think through the consequences for society, the economy, and national security on the artificial intelligence. So if you have too much regulation, it also kills the innovation. So I think we can really keep each other into the balance. So this partnership is very key for us. The other partnership, if I look in the region, is the pan-European unity, because it's a very diverse region. And we are torn apart now by this really devastating war. But the mandate of WHO is health for all. So vulnerable people have to be helped everywhere. And there's some sub-region blocks are very important, like the European Commission, the European Union. And I would like to comment here, particularly the Director General, Ms. Sandra Gallina. I know that she was supposed to be on our panel, but there were some urgent issues at the last moment. For example, having done a great job on the joint procurement of the vaccines. I think that was really a silver lining in the dark times, and sharing beyond Europe as well. And also the working together to save a lot of lives due to the war in Ukraine. So I'll finish here, but I remain with a good dose of optimism. I would say I was born as an optimist, but I must say at this time we have to be realist as well. So we have to be politically astute, listen to the people, but stand very strong as a community on our principles of solidarity, universality, equity. And like this, I strongly believe if we put health and equity at the heart of all policies, that we can regain societal trust, which we desperately need. Thank you.
Thank you very much, Dr. Klug. First, we are pleased to make sure that your daughter thinks you're part of a hip hop crowd. So that's the best service we've provided today. But your reminder to us about the crises that have happened in a very short period of time, especially in your region. But congratulations to you and your colleagues for this tripartite agreement between both sides of the Atlantic that is going to be done tomorrow. sounds absolutely fantastic. And we are so happy that this regional meeting is where these discussions are happening today. Ambassador Baloch, you've heard the three other colleagues reflect on this topic. We are privileged to hear from you on this issue of global health in a political world.
Thank you, and good morning to everyone. I'm very humbled and honored to be part of this distinguished panel and of this distinguished audience because let's face it, I am the odd person out. I do not have the qualifications that you all have and the contributions that you are making in terms of global health and for humanity as a whole is inspiring. And I am grateful to be present here. My participation here would be in the context of as a representative of my government in dealing with international health negotiations, including representation at World Health Organization in Geneva. And my intervention would be based on Pakistan's perspective as a developing country and our experience in facing the latest challenge that we all faced in COVID-19, nationally as well as part of the international community. And when you ask this question about the linkage between politics and global health, I absolutely agree that politics has a critical role to play to ensure equity and global solidarity in health matters. And at the international level, the reality is that states always act in respective national interests. Of course, the aim is to protect their population, but it is always the national interest that reigns supreme. Yet time and time again, we witness a sentiment of international solidarity on global health challenges and developing common health protocols. And World Health Organization is the ground zero where this consensus between states develops around global health challenges that we face today. However, the medical community, the civil society, the private sector, they also have an important role to play in forging this international consensus. In this context, non-WHO platforms on health-related issues, such as the Health Summit, have assumed increasing importance. In an ideal world, global health should have the same basic requisites as what we expect from our national health systems and policies, that it should be affordable, it should be equitable, and it should be accessible. However, what we are witnessing is increasing politicization of health debate globally, especially whenever we are faced with global health emergencies. And this is what we all witnessed during the COVID-19 pandemic. Instead of joining hands together, we were debating about the origin of the COVID and in many ways giving rise to xenophobia. Most effective responses when the states were trying to determine the most effective responses, there was a competition in casualty numbers. And we were criticizing the other nations' responses. And then the vaccine denial by leaders and opinion makers added to the health challenges. And lastly, the vaccine nationalism that was practiced by everyone, but mostly the developed countries, impacted distribution of vaccines around the world, thus affecting access of poorer societies to cutting-edge developments. So these these challenges really created new questions. They have given rise to new questions on how we should all be working. Should we be focusing on protecting the vulnerable populations first, and then offering relief to people who can afford to do so? Politics and competition between countries is also having an unintended consequence in WHO, as WHO's methodology, response, and advisories are routinely challenged and called into question by states. But things are not that bleak. There have been some positive developments as well. COVAX was, although belated, was a very positive development. Coming together of multiple stakeholders, governments, the local authorities, medical experts, the scientific community, the NGOs, especially at the national level, was a major development in terms of how we find solutions for health challenges and emergencies. Another important development that we saw was the enhanced experience sharing and information across continents and countries, including countries that do not always have the best of relations. And I see one of the most positive outcomes to be the decision by WHO to initiate a pandemic preparedness and response treaty to ensure that we are prepared for the future of pandemics. Now, it is important that we make sure that this treaty is negotiated well in time and takes into account all the important issues that we would like a treaty to serve. And another thing that I would like to speak about is the economics of healthcare, because what has happened in recent years is that the states have been focusing less on investments in healthcare and more on economic side of policy making. So this COVID-19 that came was a wake-up call for the makers that investments in healthcare and social sector should be an important consideration while making budgetary decisions. And now the important debate is how to ensure long-term sustainability of investments in healthcare. In this context, the financial system that supports the WHO also needs our review. WHO has performed very well under very difficult conditions. At the same time, it is important to review the financial model that supports this organization. Its increasing reliance on voluntary contributions straitjackets the organization as it factors in the priorities of donors sometimes, which impacts its impartiality and its work in many regions and on important diseases which are more prevalent in poor developing countries. Now, going forward, and among the lessons learned, what I would like to highlight is that first thing that we have to ensure is that investment in healthcare is a smart economic decision as well. Important lessons have been drawn, and our response should be based on the lessons that we have learned. With empathy and collaboration between governments, civil society, medical community, and international organizations, we can find win-win outcomes. We should also remember that there is no cookie cutter approach to medical emergencies. Global health challenges can have solutions depending on the countries where these challenges are more profound. And next, I would like to highlight that communication and cooperation between countries, across continents is critical to manage global health challenges. Disease surveillance and response would be effective only if we have more robust systems of communication, especially among the medical community. And lastly, we have to strengthen the WHO and its partners and our respective linkages with World Health Organizations. Because World Health Organization still is one organization that enjoys universal confidence among nations. It is important for all of us to strengthen it, to make sure that it has the requisite funds, that it has the requisite support. And when we have emergencies, we do not make it controversial and call into questions the decisions that it is making or the advisories that it is issuing. So I would like to close here and conclude here, and thank you very much for giving me this opportunity.
Thank you very much, Ambassador Baloch, first for speaking frankly, for your analysis of the World Health Organization, but very importantly, for also reminding us that the perspectives from low and middle income countries may be different and important and need to be included in global health policy decision-making at all levels. Really appreciate the perspectives that you brought and your terminologies, which you talked about vaccine denial and then vaccine nationalism, which led to concerns on vaccine poverty around the world. Very important aspects that we will get into. So my esteemed panelists don't know that in my day job as a professor, I often challenge people when they come into my classroom. And so you're all here with me, not for the easy questions, but also for the tough questions. And I'm going to try and see if we have rotating mics, and I'll try and get a couple of questions from the audience. But before I do, my concern is, why does it always take a crisis to think about things like this? Why did it require COVID-19 for the streams of global health and political stream to discuss things together? Why is it that we only focus on our successes? Why isn't it that we analyze our failures? Because it is in the analysis of those failures that our institutions, be it public sector or UN institutions, can actually learn. So I'd like each one of you to reflect for just a couple of minutes with me on why does it take a crisis? And why isn't it that we can learn from existing failures in a state, which is, let's just call it more of an equilibrium than a crisis? Dr. Jarbas, starting with you.
Thank you. You know that when we look to at least the last decades, crises were really created opportunity to improve things. Maybe because during this crisis, the health sector got much more attention than it used to have. So I think that when we look to for instance, the International Health Regulation, there was a working group in WHO that worked for 10 years, 12 years, and nothing was. No country was really willing to make changes. But the SARS crisis showed us that the old version of the IHR was totally unable to prepare us to new challenges. The failures on the Ebola crisis response in 2015 changed the way that we are prepared for health emergency. So I think that I'd like to say that it's more important now that we understand that we have this window of opportunity. So it's very important to have this kind of high-level conversation with heads of state, with ministers of economy, finance, with Congress, about how we can first translate the lessons that we have learned during the pandemic to improve the health systems at the country level. Not only to be better prepared for a new pandemic, but also to build a more resilient health system, to face this complex scenario that we have now, where communicable diseases still persists, while non-communicable diseases and their risk factors are increasing among the poorest families, the effect of climate change. So how we can build a really resilient system, I think that is the challenge that you have. And I am at the same time optimistic, my colleague, but realistic that this will not last forever. So I think that it's very important to have this global agreement about this new instrument, because I would like to say that the solidarity maybe was one of the first victims during the pandemic. And if we don't implement a mechanism that can guarantee equitable access to vaccines and tools, I think that this will be a failure that you cannot afford to do that. The new generations will blame us if we are not able to guarantee that we will provide an equitable access to them. So I think that I don't, maybe the anthropologists, political science, sociologists will reflect better about what are the causes of this, but this is a fact. When we have a crisis, we have an opportunity to improve things, and let's get the opportunity that we have in front of us.
Thank you, Doctor. Very well said. Ms. Pace.
So sadly, we don't get points for planning. It just, it's not something that people, I mean, we know this is public health professionals, right? We can forecast and we can sound the alarm about prevention being worth the pound of cure or whatever the saying is. And we just are shouting into the void, sadly. I don't quite know how to correct it, but I wonder if this moment does present an opportunity to remind people of what we had been saying about healthcare infrastructure, about health disparities, right? It's like, hey, remember in the 80s and 90s and the aughts when we were saying we weren't ready for this? You see, we weren't ready for this. And this is the consequence of a lack of investment. But I know that we all know, particularly in political spaces, that the cycle and the incentives still don't allow for us to get credit for that. So I too ask how we change it, knowing that that's a problem. I think another thing we don't get points or credit for is vulnerability. And so this part of your question about how we assess our failures and drawbacks. I mean, you're just out there, then put on a well, there are many expressions for what happens when one, say, testifies in front of their governing bodies, right? And you would like to be honest in that space, and yet you're penalized, when you say, well, yeah, maybe our agency or our department or our institution could or should have done better in this space. I don't think that that's applauded enough when you proactively or even reactively tell the truth about that. And so then people kind of hide it under a bushel, right? And maybe they at best fix it behind the scenes, but it's not something that's out in the open and celebrated in a way where we can all learn from that. Now, I do think that there were leaders and there were communities, certainly, if not whole countries, that did embrace that and benefited from that. And so perhaps part of this cultural shift that I think needs to happen is informed by those examples, right? Because the way we have been doing it, like I said, has not been working, and yet that I think will be part of meeting the moment. So I don't know about people in the climate community, for example. I don't know if people showed up at COP27 or whichever one we're on now, really with a different mindset because we were learning still from COVID. But I think the more we can kind of revisit this question real time, then maybe that'll help shift the thinking in this space.
Thank you. Thank you very much, Ms. Bays. Dr. Klug.
Thank you. So first, I would like to support Dr. Jarbas when he told about the pandemic accord. I think that's a tremendous opportunity indeed. So we, as the ambassador was telling, we have to take this very, very serious. And then a number of points from my personal experience is, number one, that human memory is very short, which sometimes is also not bad, honestly, because we went through quite a traumatic experience, particularly in some of the richest countries like Italy and Spain, when the hospitals really were breaking down. So human memory is short. And what I learned is that there is usually only one policy issue dominating the political agenda. And now talking to presidents and prime ministers, they're very happy to move on, right? And there is defense and there is energy and not to talk about health anymore. So that's why we try to be more smart. We try to be smart in WHO Euro during the economic crisis and to get the Minister of Finance on board. And we had a lot of very, very good evidence on co-benefits and how health is a driver for the economy. But honestly, we failed. We had, I think, at the conference, like maybe 2 Ministers of Finance from the 53. And then we tried to become again a little bit more smarter. And we had a small group of former Ministers of Finance to help us. And the first thing they told us that we still failed to make the case and that we are speaking very complicated language. They say, but Hans, you know, we don't understand. You have such a complicated incidence and prevalence. And we, Minister of Finance, we're very simple people. We basically have a vocabulary of 25 terms, and they all boil down to no. So then we understood we have to really engage with them. So this time, when the COVID-19 started, we tried to be more smart, and we established an independent commission, the Pan-European Commission on Health and Sustainable Development, to rethink policy priorities in the light of pandemic. Not only to be better prepared, Professor, but also to scale up again to the SDGs, because we have a huge backtrack of the SDGs. And I called Professor Mario Monti, who used to be Prime Minister in Italy, when Italy went through very, very tough austerity times. He was also European Commissioner for competition and a world-known economist. And I remember when I called him the Sunday afternoon, he extremely polite. He said, but Dr. Kluger, first, oh, I didn't expect this phone call Sunday afternoon. And then second, you must have dialed the wrong number. I have no clue about health. I say, actually, Mr. President, that's exactly why I want you to be president of my committee. And he helped us a lot. And this committee, I think one of the innovations was that the majority were non-health people, former heads of state, ministers of finance. Actually, at the call that was published March, I think 2021, the first recommendation was to have the G20 joint task force between health and finance, which is working now to institutionalize already, and a number of other recommendations like the dual track. Now our countries are working on dual track. It means that the health system has to manage the crisis while being better prepared, but at the same time, continue essential daily health services, like cancer screening. I mean, that's a catastrophe that the cancer screening, you know, so many women have breast cancer or cancer, which are absolutely not necessary. But are we there? I think we made a huge leap forward, but the lesson I learned, it's a never-ending story. But definitely the direct country, nothing beats direct country contact. That's why I'm the whole time on the move. The contact we established with the prime minister, the presidents, we have to hold on to those ones to continue to help us.
Thank you very much, Dr. Klug. Ambassador.
Yes, thank you. In response to your question, I should say that, of course, there's no bigger wake-up call than seeing death in your family or your friends, as we all perhaps saw. And that is a wake-up call for communities, for governments, and for all of us as individuals. So at least our generation and the younger generations, which have seen through this for the last 2-3 years, would remember this emergency for a long time when they are making decisions on healthcare, about budgetary decisions pertaining to healthcare, and about international cooperation on pandemics and on non-communicable diseases. Because we should also remember that this was one emergency, medical emergency that we all faced, irrespective of our nationality, of our gender, the continents that we live on. And it does not mean it is HIV/AIDS is no longer there. It was always there, but it is in Africa. It does not concern me. It does not concern majority of the world. So we forget about it. But it is still a medical emergency, especially in Africa. So perhaps this would be a good opportunity for all of us to, in the medical community, but also in government, in the civil society, to reflect on what has happened and how we can avert such crises, to bring back spotlight on those forgotten diseases, which are diseases of the developing world. Polio, you mentioned polio, for example, but there are other diseases. The tuberculosis has made a comeback. It was supposed to be a poor man's disease, but it is again resurging. So this is something on which we would all have to work. And lastly, unfortunately, because of the COVID emergency and then the recent challenges of war in Ukraine, all countries are facing economic difficulties. And we have less and less budgets that we can live with, especially in terms of healthcare. That is a double jeopardy that we are all facing, and perhaps we will get on the other side in a more concerted fashion, and together we can find solutions to the challenge that we face.
Thank you very much to all four of you for those reflections. Clearly, crises bring attention, resources, political attention, financial attention. But I love the fact that we don't get points for planning. And we spend hours in schools of public health and medicine teaching that we should be planning and preparing, and yet we don't get points for it. Very fundamental breakthrough, in my opinion, that you've stated. And then no points for vulnerability. That honesty, transparency, and engagement, and yet we have to be very careful in the political arena to do that. That's where this stream talking to each other becomes incredibly important. You've been extremely patient. I'm going to open up for some questions from the audience. However, before the mics are circulated, I'll let you know who to go to. You're not here to make a speech. So you are not the panelist. So I will give you 1 minute to ask a question. If you can't summarize your question in 1 minute, then you need to keep thinking. When you're ready, give me your hand, and I will take 3 questions. Sorry, folks, that's how I moderate. So we're going to take, and if I could, where are the people with microphones? I have one here and one here. Okay, I first want to start with the lady over there who raised her hand first. Heather, can you get to, yes, this lady wearing in black, and I'm going to take a few questions and then summarize them for my panelists, and you can reflect on all of them. Yes, ma'am.
Hi. First of all, thank you so much. This is wonderful to see people live and not in my home office, which is a mess. Second of all, I just am going to make this really quick. I think this is to Ms. Pace in regards to depoliticizing public policy. Can you elaborate on what benchmarks we can do in this very divided world that we're living in right now, and what does the success look like? Thank you.
Excellent question. Thank you very much. And by the way, all questions will be put to all panelists because they will all have an opportunity to reflect. Mohammed, can I get you to go to that young lady there who's raising her hand, second in seat right there? Yes. Right here. Yeah. Yes, please.
Thank you. I'm going to be very fast. Professor Brunette, Global Health Equity. And this question is on behalf of the 65 million US hardworking Latinos in the US, the third largest population in the region, and because I read regional meeting in health. So what can be done to effectively address the science policy gap? And can you just share with us, not only for the region, but the problem of global migration and the health of migrants? Thank you.
Thank you very much. I really want to give an opportunity to some of our students here. Yes, this young lady right here.
Hello, thank you, speakers. My name is Sarah. As I'm attending some of these conferences, these meetings, and I'm noticing that there are certain trends emerging, such as increasing health financing, strengthening health systems. I'm noticing we're identifying patterns, but not relevant examples or case studies. Are there examples that you can give about how this has successfully implemented into actual governments, whether local, regional, national, etc.?
Thank you very much. We're going to pause here for a second. I'll see the efficiency of the panel in answering this. If they're extremely efficient, we'll do a second round. If they take longer time, then we'll do this. So, eminent speakers, we have a question on depoliticizing public policy and the benchmarks. We have an issue of, in your case, you mentioned Latino healthcare workforce. I may generalize it to healthcare workforce, looking at the science policy gap in particular. And then, important, we are talking theory. Where are the examples? Where are the success stories, right? And a call for that. So I'm going to go actually in reverse order. I'm going to try start with the ambassador this time and work my way here. You can pick and choose any question, any reflection on these three items. Ambassador.
Thank you. The questions that have been asked are very interesting, and I would perhaps speak about some success stories. When COVID-19 hit, I was serving as ambassador of Pakistan in South Korea. It was one of the first countries which was hit with COVID-19. And it had a very unique test and trace model that it introduced. It was basically based on their earlier experience of fighting SARS. And they had developed certain protocols which came in very handy when they were developing their response to COVID-19. So I found that to be a very efficient system, a more humane system, and many lives were saved. And it was also a system which I believe was very, very comforting for those of us who were living there. We never had shutdowns. We had normal lives. Of course, the contact with your inner circle was limited, but life went on. So what I saw was a country learning from a previous challenge or emergency that they faced, and then they were able to build on that, develop protocols. They worked on it over the years, and they had perfected this system by the time COVID-19 hit. Another example, I think, in terms of responses to vulnerable communities, I think was Rwanda. They did a very good job, especially in terms of access to give protection to women, to vulnerable populations. And that is, again, something that I believe was a very positive lesson that we can learn from these countries.
Thank you. Thank you very much, Ambassador. Dr. Klug.
Thank you, Professor. So on depoliticizing, that's a very tough one. So I think it's very important that we exploit all scientific and diplomatic channels on that one. As a WHO, we are a member state-driven organization. So we don't blame and shame, but benchmarking, use the word, is very important to bring a number of countries together so that countries can look towards each other. If there is a political leadership which is against the evidence, I think we have seen several examples, it's very, very difficult. And then partnership comes in. I think that's why it's so important to work with the civil society and the NGOs who really can help to reach the unreached and to go to the last mile. But we're facing this also in many areas. One is on sexual reproductive health and human rights and access to safe abortion, for example. There are 8 million people from Ukraine who have left the country. And in a number of countries, including in the EU, for young women, it's difficult to get access to safe abortion or even contraception. So there, again, we have to go as a WHO with scientific diplomatic advice, but partnership with civil society, NGOs. On global migration, that's something which is very hot topic that we're working on. 3 weeks ago, we were in Sharm el-Sheikh with 3 regional directors of EMRO, AFRO, and EURO on exactly a new narrative on migrant health, and to go from the old narrative to a positive narrative. For example, for my region, looking at the demography, right, that the tremendous aging population. And last year we started in Istanbul. This year was in Sharm el-Sheikh, and then Dr. Mawita Chihedi from the African region invite us to the African region, and we of course invite very much the other regions as well. Last point, there are many success stories. I think that's a very good point, because sometimes you look a little bit too much to the failures, but on health systems, we always have to keep in mind that it's very contextualized. So there is not one system that we can copy paste to another country. We can learn on a common denominator of enablers, right, and failures. But to name one block of countries in the COVID-19, I would say the one that is hosting our regional office is Scandinavia in general, where in general there is a high trust of the society into public governance, because it's a society which is very equitable. People know if I'm a mother alone with children and I really get into trouble, the state is going to take care of me. My children is going to continue to go to school. I'm going to get healthcare like another rich person. And that translated, among others, into, for example, a very, very high vaccination rate. Thank you.
Thank you very much. Space.
Okay, well, on this question of politicization or the reversal thereof, it's interesting because it used to be that maybe only parts of health were politicized, right? I used to work in cancer. That was very safe. I think there are other parts that weren't as safe. I think now we see all of health under attack, which is scary. And it presents an opportunity for us to join forces, I think, and really, kind of hold hands in solidarity with one another. I think what we can do too is point to a time in the not too distant past when we had this figured out. So HIV was very controversial and very political, and people who lived through that and championed that did so quite effectively in a way that now we can say, how we had this big fight over ARVs. We don't have to repeat that fight when it comes to vaccine equity for COVID, right? And we use that, I think, somewhat effectively. The US moved faster than it did on HIV when it came to COVID. Some might argue not quickly enough, but I think that those are the types of examples or metrics we should be pointing to. It's similar with immunizations and the great stories we can tell about vaccinations for polio, for measles, for other conditions that we know are on the rise as people pull away. But we could say, look, we get that people are hesitant around COVID vaccines, some communities, and here's all of the information and evidence we have as to how this has worked in the past. So again, kind of linking these other issues, historical examples of controversial issues with sort of debates of today. I just want to also touch on this question of examples as well. There are a couple that I've already thrown out, but again, this might seem too passé at this point to mention, but I do remember when we weren't required to wear seatbelts in this country. Mm-hmm. I remember taking flights and people smoking on airplanes, right? And smoking in medical and health meetings. So, and those were not hard-won fights, to be clear, but we won them, and we won them with evidence, and we won them with political action, and we won them with resources, right? Think about the Master Settlement Agreement for tobacco control. So yes, it seems like we are very far away on that with guns or abortion, even losing ground. And yet we do have examples where we push through. And I think that's what keeps me at this table and maintaining some sense of hope that we can do it again because we've done it before.
Thank you very much, Ms. Space. Dr. Barbosa.
Thank you. No, 3 very important questions, but let me add something about this depoliticization But I think that you need to see I think that a broader perspective, because of course, I think that what you are talking about is about the use or misuse of public health or health measures made by many politicians during not only the COVID-19, but in many other health crises. Of course, this was a very important problem, and I think that the heads of state that were denying the pandemic or were against the public health measures or were denying the vaccines and were promoting medicines that at the beginning we had no evidence that they worked, but after some months we had evidence that they didn't work, but they were still recommending them. Of course, that this we need to learn from this experience. In some times, I think that we need to first to build a more broad alliance, as Hans mentioned, with academic institutions, NGOs. We also need to learn from the process to translate evidence to the society and to translate the recommendations made on evidence. I think that we cannot use during a public health crisis the same process that we use in regular time. We cannot wait 6 months to make a recommendation about wearing masks or not in closed space. So I think that we also need to learn with our own failure, because sometimes this is allowing a kind of a vacuum that is being occupied by all this noisy and misuse and political issues. But at the same time, we also need to see to the other side. I fully agree that if we don't have a very strong political allies, we cannot translate many important public health policies into real public policies. And when we learn from the advances that we have made in many success stories, at least in this region, about tobacco control. So in many countries in the region now, we have only half of the prevalence of smokers that you used to have 20 years ago. The challenge now is the youth in the poorest, because they are still smoking. In some countries, we have this data disaggregated. The prevalence of smokers among them is the double of the national average. So we need to see what the strategy to act against them, against this tobacco industry, the promoters of tobacco use, etc. And also front of label packaging. We have, despite all the opposition from the food industry, we have made many advances in countries in the region. So these are also success stories that were built because we made the case to the politicians. We had the alliances with civil society, with the Congress, the academic institutions. So I think that this is also the way that we need to do. And just one word, I think that the health workers, that this is a very important part of the response that we need to implement, because we have around some hundreds of thousands nurses and physicians, that in public health professionals, of course, too, that we need in this region. And with them, in the quantity and with the proper training, we cannot have resilient health systems. We cannot have renewed and strengthened primary health care. You cannot have universal health. So we welcome the US initiative about the American Health Corp, and we really want to work together with them in order to provide and to provide to the countries alternatives that can fulfill this very urgent need that they have.
Thank you very much, Dr. Jarbas. Folks, all good things have to end, and the time has come to begin to close this. We must remember what Dr. Barbosa is saying. He's saying you must work towards resilient health systems that can take these shocks. We must remember what Ms. Pace is advising us, that even though you may not got points, you keep working, because there is a mission, there is a vision. Dr. Klug is requesting us to be politically astute, use all our diplomatic channels, and look for cooperation. And Ambassador Baloch reminds us that from a low and middle income country perspective, inclusion is critical and successes need to be celebrated as well. That is the confluence of global health in a political world. A state which is complex, it is not easy, but we have to become comfortable with it. Our students, our professors, our faculty, our practitioners all have to be comfortable playing in both fields. It is high time that we rise to the challenge, because if we don't, there are many others who are willing to rise with lots of misinformation, lots of debate, and lots of arguments that will win the day. For that reason, please join me in thanking all our four eminent panelists for the wonderful contributions that they did. Thank you. Thank you to all of you in the room and to those who are online. It's been a wonderful start to our summit. Please note, we have sessions throughout the afternoon. We hope you enjoy them, and lunch is served outside as well. Thank you. Enjoy the rest of your day.
Was my great.